We're here to talk about UroLift. It's a procedure we do at GBU in all of our care centers. Thank you guys for coming out so we can sit around and give us some information for our patients and help make this procedure a little bit more accessible and available to our patients. So, Dr. Lin, what is a UroLift?
UroLift is a minimally invasive procedure that's designed to open up the prostate channel, open up the channel where the man pees from, constricting from BPH over the years. And it's a great alternative to someone who don't want to take medications long term, who have side effects from medications, or simply the medications like Flomax aren't working as well as the patient wants. And it's another great alternative prior to jumping into something more invasive like a TURP, a transurethral section of the prostate, which is a full scraping of the prostate that's done under general anesthesia, has more risk with incontinence or erectile dysfunction and no more ejaculation.
And Dr. Geffin, what kind of the symptoms of your patients who come in, or who do you typically recommend these patients,
Yeah, so the general patient I'm seeing for the UroLifts are similar to Dr. Lin's, the patients who've been on the medications, who have failed, or someone who doesn't want to take a medication or can't for a number of reasons. And they're the men with the enlarged prostate as well, blocking the channel. And we do the evaluation to make sure that they do meet the criteria. There are certain size restrictions for the UroLift, but the vast majority of men are candidates for it and have done quite well with the outcomes and quite happy.
Dr. Fitzgerald, how do you typically do this procedure, and where does it get done?
So the majority of them can be done in the office with local anesthesia, although if a patient does not want to have it done under local anesthesia, it can certainly be done with anesthesia too. There are some people that just prefer to be knocked out or to be under anesthesia, and that's fine. But the majority of people can be done in the office. So once they've been evaluated to make sure that they're a good candidate for it, we will typically do that by first assessing their symptoms and then looking into the bladder in the office with a small flexible telescope to look at the inner anatomy of the prostate. And then we'll also do an ultrasound to measure the size of their prostate. We do that with a transrectal probe. So it's like a rectal exam. Most men are familiar with having a rectal exam, which isn't pleasant, but it's not so bad. And we do an ultrasound to measure the size of the prostate. The FDA has now approved men with larger prostates to have UroLift. So the majority of men meet the size criteria now. So then if they have symptoms and their anatomy is good for UroLift, then we offer that along with other treatment options as well. And if they're a good candidate for it and they choose it, the majority can be done in the office with local anesthesia. Most of us do at least urethral lidocaine jelly, so we'll put some gel injected through the penis into the urethra and let that sit for about 20 minutes. And then some of us also do a prostate block, which is done with the ultrasound probe in the rectum, and we'll inject with a very small needle, we'll inject some lidocaine around the prostate to provide some additional anesthesia to make them as comfortable as possible. And then we try to use some verbal anesthesia too. We have an excellent team of medical assistants, nurses. Our urology consultants from Teleflex are superb at making the patients feel as comfortable as possible to get through what can be, not the most pleasant experience if we didn't do all of this. And so then we do it, and we pass the UroLift scope through the urethra once the block has been put in and the lidocaine jelly has been put in, and we will then put the implants in. And depending on the size of the prostate, we'll put in 4 to 6 or sometimes even more implants into the prostate. And the patients will hear clicking noises and ratcheting noises as it's being done, and we'll kind of warn them about that. And the procedure lasts usually 15 minutes or so. We can get them through it, and they usually remain pretty comfortable. Then we'll finish the procedure. Most patients will have a voiding trial right there, which means that we'll take the scope out and we'll let them try and urinate. And if they're able to urinate, they can then go home without a catheter. Most of the other enlarged prostate procedures that we do, patients need to go home with a catheter. Some patients after UroLift still need to have a catheter. We can never promise they won't have one, but the majority of patients pass this voiding trial, we call it, and can go home without a catheter and then usually continue on their medications for a couple of weeks. And then when we see them back afterwards, we'll have them stop their medications. And most people by 2 weeks are voiding a lot better. They have a period during the first 2 weeks where they're having some, burning with urination and maybe some blood in their urine and more frequency. But that's just because they've had a procedure done and things are going to be irritated and need a little bit of time to heal.
Yeah, I feel like by about that 2-week mark is when most of the patients really start feeling
really turn the corner,
feeling really good, and we can start kind of getting them off those medicines at that time. The way I describe it to the patients is it's like you have your blocked channel from where you pee, and you're kind of pulling things apart using tiny little stitches, and it's those little clicks and that you mentioned that are those stitches being deployed in that prostate. So it's nice you're getting that opening channel effect without actually cutting away any tissue or using any heat or steam or any kind of disruptive forces to the
We're
tissue.
not destroying tissue, we're just moving it. As somebody pointed out, a great analogy is opening up the curtains over a window. So you're just opening it up so you can see. And so the urine can get out more freely. It's not blocked or obstructed. So I think that's a good analogy.
I think that should also be highlighted that UroLift does set itself apart from the other treatment options that we had that were minimally invasive, like Resume, TUMT, or Tuna, that they all required heat or destruction of tissue or thermal energy. And it's not uncommon that all those procedures, patients had to go home with a catheter, and it was not uncommon that things got much worse before they got much better.
Right.
Here, it's nearly almost instantaneous, opening up the channel.
Yeah.
So it does set itself very quite apart.
Yeah, and I think patients really appreciate the fact that it is a truly minimally invasive procedure from that standpoint, and I think it's a great feature for it.
I've also found that the patients, when they're going through the procedure relative to the thermal energy procedures, during the actual procedure, it's much better tolerated.
Yep.
And the outcomes at the end of the road, 2 weeks, 4 weeks, 6 weeks down the road, they're much happier relatively than what I've seen with my thermal energy patients in the past.
Yeah, they're happier sooner. I think you're absolutely right. Yeah.
One of the things interesting about UroLift is actually, I think it's the only, correct me if I'm wrong, but I think it's the only study that's looked at the effects, up to 5 years out of these more minimally invasive procedures. And so you're able to see more of a lasting effect with men peeing better, stronger stream, more quality of life, or that kind of effect is sustained over those course of the 5 years with really low retreatment rates. Because I think that's oftentimes patients will ask me, well, does it actually work, and is it going to work for me in the future? They only have about a 10-15% rate of retreatment at 5 years, which is really good for a procedure like this. So I think it's great.
It works well, it's efficacious, and it's durable. It lasts a long time. I think those are two important things to patients. Is it going to work?
Yep.
And is it going to last? And I think from what we've seen, the answer to both of those questions is yes. It's very effective, and it's going to last hopefully for several years.
Yeah. Are there any kind of patient, you guys recall any patients who went particularly well or were particularly grateful that they actually did this procedure? Some of my patients often are fearful of going under anesthesia or fearful of getting, the classic roto-rooter type procedure, and so they kind of drag their feet a little bit. And I find oftentimes patients are super happy after this and they say, I should have done this, 5 years ago. I wish I had done this earlier. So has there been any kind of patient encounters like that?
I have. I had a patient who was a teacher. He was actually a retired gentleman in his early 70s, and he would teach. And during the classes, he'd have to call another teacher in to relieve him so that he could go to the bathroom. And when I saw him about 4 weeks after the procedure, he said his stream was better, he had better control, he didn't have to call anybody else in, there was less urgency, less frequency, better stream, he felt he was emptying better.
Dramatically improved his quality of life.
Something which stuck in my mind from his story, how it really impacted his quality of life.
That's awesome.
Yeah, I think you do hear that, and I think you hear from patients that, geez, doc, my primary care doctor had given me these medications. I've been on them for several years. Yeah. If I had known that something like this was available, then I would have done it sooner. And I'm so glad that I did do it. So
I think we all take sleep for granted sometimes, and if the typical patient has to wake up 3, 4, or 5 times a night, and it's disrupting their sleep, and once they have the UroLift procedure and they're saying now they can sleep through the night or actually just get up once, which is a much restful sleep than getting up so many times at night. They're also so much happier and can function better the next day.
Yeah.
Do you also hear that sometimes you'll see a patient who will say, I had to know where the next bathroom was. I would go to the bathroom before I would leave the house. Now their mind is clearer and they're not really so worried about finding a place to go emergently or urgently when they're out and about.
They're not stopping 3 times on the way to the Cape for their weekend trip because they've got to find a bathroom.
They're not worried about making sure they know where the bathrooms are at all the malls and restaurants and stores, and they actually can pee every 3 hours, every 4 hours, and it just gets in the back burner, which is how we want it to be, right? We don't want us to be on the forefront of our patients' minds, needing to pee all the time. So I think one of the great things about being at Greater Boston Urology is that we're kind of in the forefront in Massachusetts about bringing this procedure to our patients in the office. Actually, recently I just learned that Dr. Lin is was the first physician in Massachusetts to do this procedure under local anesthesia. So tell us a little bit about that experience and how you kind of talk to your patients about doing the procedure.
I did, yes. It was done on purely local anesthesia. Patients were awake. Just conceptually, learning about the procedure and understanding more about the procedure. I mean, it's very well designed for an office-based procedure. Of course, patient comfort comes first, and safety, and they're very well medicated with some pain medications, something to help them more relaxed. And I do numb them up with local anesthesia through the urethra with lots of numbing jelly, and I also do a prostate block as well. Periprostatic and intraprostatic. So that means around the prostate and within the prostate. And patients are very, very comfortable. I mean, we do cystoscopies. We look inside the bladder, all the time with local anesthesia, and patients tolerate it very, very well. Yeah. And it's merely an extension of just taking a look inside the bladder. Very proud and happy that patients have done very well, and to a point now that I think within GBU, with everyone here, that we're probably one of the most experienced, practices that offer and do UroLift procedures, down from the surgeons with the medical assistants or the nurses in the room. So it's a great procedure.
Yeah, I think that staff experience and that staff really makes a big benefit to us as being able to take care of the patients and have it be a good patient experience for them. So that's great.
Absolutely.